All right, good morning, everybody. We're going to observe how to change a dressing. This isn't a sterile dressing. This is a non-sterile dressing change. So the first thing you're going to want to do is check the orders and see what kind of a dressing change it is and how frequently we change it. Let's say for Mr. Smith here, we're going to do a dressing change Q shift every shift. Okay. And so that I want to gather my supplies for this. I've got my foam, so I can foam in. Pair of gloves for taking off the dressing, and then I'm going to throw those away. Then I'm going to put on a new pair, a clean pair, for putting on the new dressing supplies. Okay? And so I'm going to come in the room. I'm going to foam. Okay. Good morning, Mr. Smith. How are you doing today? Good, good. I'm Christine. I'm a student with the University of Texas at Arlington, and my instructor is Miss Bertram, and she's in the building with me. I'm going to be working with your nurse today, Kim, and we are going to change your abdominal dressing. We want to make sure that the site looks good and there's no infection going on. Can you tell me your name and your date of birth? All right, Mr. Smith, 12/7/74. Good. Oh, that's my birthday. Fantastic. We have the same birthday. Do you have any allergies, Mr. Smith, to iodine, latex, tape, anything like that? No? Okay, good deal. Okay, we've identified with two identifiers. I've introduced myself. I've told him what we were going to do and why we were going to do it. I made sure he's not allergic to anything. Some patients will be allergic to tape. So in that instance, we usually use paper tape, and that usually works for the patients. And we always want to provide for privacy. Draw the curtain. Even if the door is closed, draw the curtain anyways, because that just gives you a little extra security just in case somebody walks in. We try and give them privacy whenever we can. Okay, so I've already foamed in. I'm going to put on my gloves. Feel free to ask any questions if you'll have any. All right, Mr. Smith, I'm going to take a look at your abdomen while trying to keep you covered. Okay. All right. And I'm going to start by, I want to hold the skin taut and then remove the tape. Wow, this is really sticky. And I'm removing it back this way. If I remove it this way, I don't want to splash towards me. How you doing, Mr. Smith? You okay? And I forgot to ask, but you always want to ask how their pain level is before you get started, just in case you have to medicate before you change the dressing. Whoa. I'm removing his abdomen at the same time. I'll set this. I would put this in the trash for future use purposes. I'm going to set it right there. And his dressing, his site looks good. What are the 5 things you want to look for when you are observing, looking at an incision? Is it, I'm sorry? Drainage.
Whether the rooms are close together or not.
Mm-hmm. Is it well approximated, or is it dehiscing, separating?
If it's red.
Is it red?
How many was it? 3?
Let's see. You always want to look. Is it red? Is there any sort of drainage? Is it swollen? You want to look for any signs of infection. Is it hot? And then do they have a fever, a temperature, signs of infection? This site looks good. The incision is red, but around the site it looks good. I don't see any redness, swelling. I don't see any pus or anything like that. So it looks good. So I've taken off the dirty dressing, so I'm going to take off my dirty gloves. And at this point, if you do want to do hand hygiene, I wouldn't discourage it. And then I'm going to put on a new pair of gloves.
So by hand hygiene, do you mean go and wash your hands? Because I don't know if you should, like, if I would be comfortable leaving the wound open like that.
Well, if he was still, then that would be okay. Now, if it was a confused patient, then I wouldn't do that.
Okay.
Because I wouldn't want to turn my back on that patient. Good, very good. Okay. So for this dressing change, I had 4x4s, and then I covered it with an ABD pad. Okay? I'm just going to cover number 1, number 2. Where do I want to not go below? When I'm waist. Good, good. All right. I have my ABD pad. So you know which side you want to have facing out. Strip is out, actually. So kind of with the masks like last week, show your UTA blue, show the blue stripe. So you want to apply your ABD pad. I have tape. Anybody have some tape? Nancy, you have some tape? You can leave your gloves on to put the tape on. Tape and gloves for me don't go well together. They stick. So I'm going to tear off a piece of tape, apply to one side. Remember, you don't want to press down really hard because this can be a tender spot. Okay. After I get this taped down and secure, what do I want to put on here? Time, date, and initials. Good. Okay, and then just take a little piece of tape. And you can write your time, date, and initials. You really don't want to put it here and then write on the patient because, again, it can be tender. Okay? How are you doing, Mr. Smith? You okay? How's your pain level? 2 out of 10? Is that tolerable for you? Is that okay? Okay, good. All right, good job. You did very well. I'm going to make sure he's safe. I have your call bell right here. You can call me if you need me, or if you miss me, you can call me then. Put your bed down. And I think that's a non-sterile dressing change. Does anybody have any questions?